So I want to try and briefly articulate 3 points. The first one is very brief, and that is in response to the terrible tragedy in Newtown. One of the quickest things I think we can do to improve our communities and the well-being of individuals in our communities is to simply not make things worse. So I want to present a counter-argument to what a gentleman just said a few minutes ago. I think that outpatient commitment is a bad idea that won't work, not a good idea that won't work. So I think the first best thing we can do quickly is not make things worse. Outpatient commitment will make things worse. We can also not delude ourselves into believing that simply by increasing voluntary access to current treatment that we're going to make our communities better. And I'll share a little bit of my story about what treatment was for me. I reached out for help from the mental health system when I was 20 years old and was diagnosed with schizophrenia, diagnosed with all these different labels. And I was told, if you don't take these psych drugs, any efforts on your part to try and rebuild or create for the first time, a meaningful life will probably fail. And the psych drugs, they might cause sexual dysfunction, they might cause weight gain, diabetes, they might lower your white blood cell count, it might cause arrhythmia, but it's really your best option to take them. So I've heard numerous people throughout the course of the day say, why in society should we wait until an individual becomes a danger to themselves or others or actually does something wrong? Why do we have to wait until that stage in order to strip them of their liberty and force them to do things that they say they don't want to do? And the answer, a sufficient answer should be in a democratic society, the Constitution. So we have police power in our communities, right? If someone commits a crime in Connecticut or is accused of a crime, not always even convicted of a crime, or a pseudo crime like homelessness, vagrancy, being a nuisance, we already medicate them and force things on them which often is a problem to begin with. So to expand that and say we should implement this shoddy pseudoscience of predicting whether or not a person is unable to take care of themselves and consequently at a future date may become a danger to themselves or others, it's a preposterous idea, in my opinion, and it's not going to improve mental health treatment for several reasons. One being that current treatment modalities have had disastrous outcomes. I encourage everyone sitting up here kindly listening to me to read a study conducted by Joe Parks, Chief Clinical Officer for the Missouri Mental Health Authority. He co-authored a study of services under his purview in collaboration with similar roles, high-up decision makers in other state mental health authorities. So they analyzed the services under their purview and wrote their own conclusions that individuals who access public mental health services on average died 25 years younger than the general population. Forcing people into that doesn't seem likely to make our communities more full of people who contribute to the greater good and aren't dangerous. And just increasing availability of those services voluntarily also isn't good enough. What I think really turned my life around was when I started to challenge this idea that I'm broken, or that all of my suffering in response to the world can be reduced to a biological brain defect, pathology, or brain disease. What I found very interesting is meeting with various roles throughout my journey through the mental health system is that individuals, including psychiatrists, would openly question with me. They would be very skeptical. Well, I know it's rudimentary science. We don't know what this chemical imbalance is, but it's there, and we're going to give you these drugs, and we don't know how they're going to treat this chemical imbalance that we can't clearly define, but they do. So another theme that's been coming up today is, I don't know why these people won't just stay on their drugs. Well, I really feel like I lost 3 years of my life on psychiatric drugs. Sleeping 16, 18 hours a day, sexual dysfunction, my face was twitching, I gained 30 pounds sometimes in a month, lose 20 pounds the next month, gain 40 the next month. So it's not simple. There's not an easy answer. There's not an easy fix. But what we can immediately stop doing is throwing all of our money into, or all of our money and dedicated time into things that haven't been good enough for the past 100 years, probably longer. So I'll end with what worked for me was when I came off of psych drugs and when I began to put the effort into dealing with some painful things and to put daily effort into communicating with individuals who had lived through comparable experiences and trying to live deliberately with a goal in mind of what I wanted to do with my life, as opposed to constantly approaching my dissatisfaction with my life by having self-absorbed conversations about my symptoms or how can I live a relatively symptom-free life with this brain disorder. Approaching life trying to manage your brain disorder, it wasn't a good enough motivation for me to stay well. So thank you for your time.
And thank you for your testimony. Any questions from the panel? Thank you very much.